Hello, I'm Dr. Steve Karstensen, Chief Dental Editor of Dental Sleep Practice, a MedMark publication. Welcome to a conversation and Q&A with Dr. Mark Newman. In our webinar today, we'll be exploring how to successfully blend a high-level restorative dental care practice with dental sleep medicine. Before we get started, I would like to invite viewers to use the chat box on the right side of your screen to ask any questions. Your questions will be answered towards the end of our conversation. Now I'm pleased to introduce our guest for today. Dr. Marc Newman graduated from Indiana University Schoolof Dentistry in 2011. He's been in practice of the same general dental practice with two of his brothers ever since. As he built a patient base similar to a startup dental practice, he simultaneously built a sleep practice within the general practice. He's been a contributor to Dental Sleep Practice magazine and a featured guest of ZZZ PackPodcast episode Sleep Champions Breed Sleep Champions. So go back and watch that one online. Dr. Mark was a former board-eligible member of the American Academy of Dental Sleep Medicine and current board-eligible member of the Academy of Clinical Sleep Disorders discipline. Please welcome Mark Newman. Hi, Mark.
Hey, thanks. Thank you, Steve.
So I want to just a few questions for you. Tell us about how you got started. You in practice with your brothers, and so you got out of dental school. Are they older brothers, or how does that work?
Yeah, so I have an older brother. He graduated in 1999, and at the time, my uncle was still practicing, and he had been one of these 40-year practicing dentists. And I think he was actually on year 40 when I graduated. And so there was not much as far as procedures that were not being done by those two guys. And then the year after I graduated, my younger brother came on board, and so from there we had this big group practice, but not a lot of dentistry to feed our families. And so that's where I was exploring, different procedures as far as what can I offer to the practice that, my uncle and my older brother wasn't doing already. And that's where I found dental sleep. Our dentists were basically just, like old school, patients complain about snoring and they make a device for snoring, but they weren't, recommending sleep studies or working with physicians. And it was one of my good friends who was, getting off of a CPAP in Chicago, and he saw Dr. Alan Moses for a Moses device. Mm-hmm. And so I looked up Dr. Moses, and I found out that he actually teaches courses. And so I drove up to Chicago, took a weekend course with Dr. Moses. And he had the entire sleep division at Rush Medical College there. There's another doctor, Dr. Roger Price, and just speaking with a lot of these very knowledgeable people in the dental sleep, industry, kind of sparked my passion towards this industry. And I learned stuff my jaw hit the floor that entire weekend. I just soaked it all in and came back ready to go.
Well, if you listen to Roger Price, your jaw might have hit the floor, but you would have closed your mouth very quickly and started nose breathing. Otherwise, he would have yelled at you.
That's exactly
congratulations.
Right.
Roger Price is one of our treasures in the whole field of breathing. So I'm really thrilled that you got exposure to him as early as you did. Mm-hmm. So you went up there, you learned all this really cool stuff from one of the early pioneers of this, Alan Moses, who has thought through dental sleep medicine and how it really affects the physiology more so than some of the other early pioneers, and an innovative thinker about breathing patterns. And you went back to your practice with your uncle and your older brother and your younger brother and said, I've got a new service. We should start doing this. Integrate that for us. How did that conversation go? What'd you do to build a sleep champion to kind of key off on your ZPack podcast?
Yeah, well, so with Dr. Moses, as you know, he is a big fan of the neurologic bite. Right. And trying to introduce some of that into the practice right away was tricky. It wasn't your standard type of dental bite registration. So a lot of what I was presenting at the time seemed to be a little, uh, I guess, what's the word I'm looking for? A little hokey, uh, as far as what my staff was used to seeing.
Okay.
So I had to figure out a way to. That's when I realized that what I was offering, what I was trying to blend in to the day to day, didn't really fit the model of a general dental practice. Not having a case under my belt yet, our office didn't really know how to behave as far as integrating, systems, how to set up appointments, what the setups look like, how much time to set up for an appointment. And that's where I went to the American Academy of Dental Sleep Medicine and went to the my first ever annual meeting, and I listened to several lecturers there, and was able to obtain more information. And then I was able to connect somehow with Dental Sleep Solutions. And it was when I connected with DS3 that I was able to implement some software into the practice that was more conducive for sleep charting and documentation. And from the DS3 network, I was connected as far as their annual symposium. And it was when I went down to that symposium, their first ever symposium in Clearwater, Florida, I listened to Dr. Erin Elliott speak. And it was in her lecture that was the first time I've heard anyone talk about practicing restorative dentistry and doing sleep.
Mm-hmm.
And so it was her energy, her passion, and then her wisdom in that lecture where I was able to go back to my office with a solid, I guess, structure as far as how to begin my journey and implement a sleep apnea system blended with general dentistry.
Well, you've certainly connected with some top quality folks there. AADSM, DS3, all those groups are wonderful. And Aaron's a good friend of everybody's for a long time. So anybody who's interested in getting started with this, watching this webinar, you might, hear those names and go, well, I can trust them. Yes, there are others out there as well that are really good too. So yes, we love those guys. We don't. This is not an endorsement, webinar for you, just to make sure that's clear. But the key to it is find a mentor, right? Is to find a teacher that can help you answer, how do I do this? Because I don't know how, but you've been there, so teach me what you know. And so as you came back then and started implementing some of this, did you start with like screening, or did you start with, right on with cases for your teammates, or what did you think to be the right place to start?
Yeah, so with Dental Sleep Solutions, they provide a lot of information and basically a cookbook as far as how to get started. They have a procedure manual, and I modified their procedure manual to fit like our office ecosystem. Because as you know, with every general dental office, there's a different ecosystem in each office, and so I was able to modify that. I held some team meetings and got a system going. But yes, screening was first and foremost. And unfortunately, the DS3 screening mechanism did not fit well in our office as far as, being a tablet screener with the Wi-Fi going in and out, the way that we moved as far as flowed through patients, how to throw in the screener. It just wasn't as systematic as I would have liked. And I had a resource over at the Ohio State University. This one of my high school friends, who's a board certified sleep physician, and in discussing with him, a much better mechanism was doing the modified circumference measurement. That score,
Neck circumference, right?
yeah, the neck circumference, and so it was. We basically ask 4 questions and we measure the neck. We would document that in the chart note. I have basically that that screener as an auto note in our dental software. And so then it was easy for our assistants to just, as part of the new patient exam, go through all the new patient x-rays, medical history, and then as far as sleep apnea screening, they would go through that, and we have these these neck measuring tape there, and if they were moderate risk or high risk, then we would recommend that a patient seeks out sleep testing.
Okay. So your team handled most of those questions, right?
Oh yeah. The team handled the questions, and then it was up to the doctor to then make the assessment as far as their sleep apnea risk and the plan as far as moving forward. And I'll be honest with you, a lot of the patients, we're screening the new patients only, not our hygiene patients. It was, much harder to implement something new into our hygiene department. Our hygienist, and I think it's very consistent with some of my dental friends I've talked to, implementing something new into the 45 minutes to 1 hour that they're given can open up a can of worms you may not be ready to open yet. So and our hygienists, they're more clinical than our assistants, and so I felt the modified neck circumference was not a good way for them to screen, but more looking at the Malampati classification, looking at wear patterns on teeth, more clinical stuff, looking at medical histories. I felt that was a better way for them to get involved with sleep screening. Still working on that, but that was I felt it was a better way for them. Our assistants more into asking questions, surveys, that sort of stuff.
So you worked with your team then to develop systems that would work with your team, in your office culture, because anytime a new service is added, it's a disruptive process.
It is, absolutely.
And I think that's what keeps some dentists from starting this, is they're just afraid of the disruption.
Yes, and at the time our office was experiencing quite a few disruptions. One, I was joining the practice, still relatively a new dentist. My younger brother was joining the practice as well too, another new dentist. Our office was going through some renovations, so we had some disruptions with physical disruptions, and then some of the employee staff, some of the changing there, and some of my uncle had left the practice as well too, and so some of the patients that normally saw him decided to leave the practice as well. So there's just a lot of disruptions and changes as a sort of side effect of what was going on in our practice. And here I am trying to get the ball rolling on not just a dental practice, building up some dental patients for myself, but also building in some sleep patients as well. And it just was slow at first, and but the ambition was there, and I think that there were some key assistants that bought into the philosophy, that believed what we were doing was beneficial and important, and so they were patient and steadfast with me.
So did you find some early successes to celebrate with the team?
Yeah, our first patient was a massive success story.
Hey.
Yeah, it was, it was a funny thing how, we're doing a team training as far as our initial team training, as far as how we're going to implement sleep apnea. And this is after I think we saw Dr. Elliott speak at the symposium, or it might have been before that. I can't remember, but the Narval appliance was just introduced into our practice. And so we were explaining the use of that and how we're going to implement that. And it just so happened during that team training, we had a patient call and ask if we offer this service. He was wanting to get off, or he had been off of his CPAP for a year and had a heart attack during that year off. 41-year-old guy with younger kids. And my older brother was in the office, and he took the phone call, and of course he's like, yeah, we offered that procedure. We didn't have a fee for it yet, so we just made one up over the phone, and what we thought was fair. And we scheduled him, and it turned out that we got his AHI down from a 27 to a 6, completely compliant. And from what I know, he's doing pretty well.
Well, that's wonderful. And I tell you, what you also illustrate right there is the need for a dentist who's thinking about adding this, who's working with a team. And your story says that your office was brave enough to say yes to a
Mm-hmm.
patient. And there's many dental offices out there that I've talked to that are afraid to say yes.
Mm-hmm.
And so, congratulations. That's a wonderful story to get started. So I got
Yeah.
to ask you then, tell me about something that didn't go so well, that you learned, that your team learned something from.
Yeah. So we've experienced just about every side effect in the book, as
Okay.
far as you have your patients that are very finicky and patients that are not. So some of the more frustrating patients are the ones where the device is just not comfortable for the patient. It takes them, a while to adjust. Sometimes, when you're changing labs, the labs are still getting used to your level of retention that you like. And so sometimes the chair side adjustments can be long. And so we've experienced long chair side adjustments, which can be frustrating for the team and can set back your restorative schedule.
Hmm.
But we worked through all that, and then we've definitely had to do quite a few remakes of devices, and after long chair side adjustments. But just the team, they saw that I was not giving up on these patients, and I think a lot of these patients that were in our chairs had given up on CPAP and had experienced other medical providers who have sort of given up on them. And so, as we see these as annoyances, nuisances, failures, we were able to spin these sort of negative experiences into have a positive outlook on them.
So it's a way to demonstrate your values of commitment in healthcare.
Absolutely.
Yeah.
Absolutely. And then, and some of the sleep testing stuff was a little bit of a failure at first. You make a recommendation after screening someone for sleep apnea, and you send them off to a sleep lab or local sleep physician, and they either come back with a CPAP or they don't come back at all.
Hmm.
And so that was sort of trying to implement a seamless way to sleep test became a little bit of a challenge. And that's where my friend from the Ohio State University was able to be helpful with the number of narvals that I was doing at the time. I qualified for a discount on some ResMed Apnea Link Air home sleep testing units. So I
Okay.
was able to get 3 of them for our 2 locations. And so we were giving sleep tests to patients at the time. So we
Hmm.
could screen them, say, hey, we have a sleep test. You are positive for or high risk for sleep apnea. Would you like to take a sleep test home with you?
Hmm.
And I mean, this is something that my rep at ResMed was advising, that we just give them the sleep test and let them take it home at no charge. And then we make up for the cost of whatever it is on the therapy side.
Hmm.
And it took years to realize that that was not cool. Like, that was not a good way of practicing dental sleep medicine. And then insurances, uh, we had denials from insurances on devices because dentists cannot be ordering uh, sleep tests. The sleep test order should come from a medical provider, whether it's a nurse practitioner, a physician's assistant, or a sleep physician, ENT, primary care physician. So yeah, so that was probably one of our biggest failures, is learning the hard way that we need to change up our sleep testing.
And I wish that lesson was something we could take from and go, well, okay, that is totally applicable in 2022. But as you know, the rules keep changing about sleep testing. So
Mhm.
what's the current state in Indiana? Can you send out a home sleep test in Indiana right now?
I believe we can.
Okay.
However, I choose not to.
All right.
So I choose to work with Nexus Dental Systems
Okay.
and utilize these home sleep testing mechanism that they offer through their programs. And I believe they are paired up with Virtuox. And so we are able to distribute sleep testing units that cannot be activated until the patient sees a medical provider through a telehealth mechanism first.
Well,
And
that
so
sounds
once,
convenient. Yeah.
yeah, it's really really convenient. It actually works out better, and patients actually prefer to speak with a medical provider about their sleep issues. And for the most part, they're better trained to answer questions about their sleep issues. And then I can relay or support their recommendations to our patients as well.
Well, that sounds excellent. Yeah, because for people watching this, one place I encourage you to go to is aadsm.org, and they have a map there, an interactive map of what is your state saying about dentists' role in using home sleep apnea testing equipment. Now, what Mark just outlined, I think, is going to be safe in every state, but actually, it says I think about it, probably not, because Georgia says you can't even distribute a device, a testing device right now, currently. But that may change, and that's changing all over the country, plus and minus. And so, just as a caveat, make sure it's okay with your state rulings about what that means for you. Yeah, as you go forward
Yeah,
with this. Yeah, and Nexus Dental Systems can tell you whether it's okay in your state or not. Yeah.
absolutely.
So, do you see that changing a lot in dental sleep medicine going forward, Mark?
Um, I'm not sure. I've always looked at the most archaic policies from medical insurances and try to adapt my systems to fit those. So that way, if anything does change, it's a much easier adaptation because I don't think things are going to go backwards. However, they might. That's always possible.
Yeah. So, talk about medical dental. You mentioned medical insurance, and so you're paying attention, obviously, to medical insurance rules. How does that
Mhm.
work in your practice? What have you done? Tons of dentists have that as their major concern.
Yeah, so with Nexus Dental Systems, they provide an entire medical billing team. So when we utilize third party billing, their third party billing. I've looked into having my office contracted through medical insurance using other companies to do that, and I think all in all, you end up paying about the same to pay companies to contract to do the negotiations for you and get your office contracted versus just using a third party medical biller. And so with Nexus, um, we would have a new patient intake phone call come in, and our front office would then get them scheduled for a sleep new patient consultation and dental examination. And during that phone call, uh, they'll receive an email where they have the opportunity to provide their medical insurance through email, we will also try to get their medical insurance through the phone call. Once we have that, it's just a portal away as far as relaying that information to the Nexus Dental Systems billing team. And then that will allow them to provide us with a verification of benefits within 24 to 48 hours. And we can see, if they are eligible for a dental device, what their deductible looks like, what their in network and out of network coverage looks like. And then they will also analyze if it makes sense for us to utilize their in network benefits or utilize their out of network benefits. What makes the most sense? If it's not much difference to utilize their out of network benefits, we might go that route. But if it's their in network deductible is hit, then we will probably utilize their in network benefits.
Yeah. So they have ways to do it both ways out of
Mhm.
every individual dental office. Okay, that's interesting. Yeah. Okay.
Absolutely.
So let's pivot just a little bit, because somebody calls you and they're asking for general dental services, and they
Mhm.
come in. You have this nice workflow for screening, and they turn out that sure they're at risk, but they called you about dental services.
Mhm.
So you're going to introduce, as an airway or sleep awareness by the screening. The next step is the patient realizing, A, I guess they're in a different kind of a dental office, and B, what about these dental services that the patient knew to ask you about? So how do you blend in the new information and make sure the patient's comfortable and heard?
It's a very busy first patient experience in our office. Let's put it that way. Well, so Nexus Dental Systems also does our consulting as well, and they did the majority of our um, sleep apnea training for our assistants. I did it at first for the first 7 years, and I felt like I wasn't getting anywhere and had to make a change. So for our the way we're doing it now, we're focusing mostly on dental first for our new patients. They come in, they're not ready to hear that they could potentially have this life-threatening airway problem. They're ready to hear about teeth and gums and broken teeth and how they can get better with their oral health. So first and foremost, that's what pays the bills in our office. And so we focus in on the restorative dentistry first, but we will still have a sort of a treatment plan for their, at least a plan for their airway, which we then will put as mostly secondary, unless the patient says, hey, I want to start here first.
Mhm.
So it's basically we present all of our findings on that initial examination, teeth and airway, and then we talk to the patient about, hey, what do you want to start first? And if it makes sense, their teeth are healthy, there's no perio issues, then we will go ahead and start with the dental device if they want to, or start with the sleep testing if they want to, and go from there.
So, okay, that's interesting, because if they hear about the airway, they may be excited about us, like an anti-snoring device or something to address their felt need. But
Hmm.
you have restorative to do, and so they say, "Can I have a snoring device?" And you're looking at that, going, "That may slow up my restorative or complicate it because of temporaries or whatever the case." So walk us through that conversation where they're kind of asking for both.
Well, that's why I keep my taps stocked in my office. So for patients that have restorative needs, um, and we want to, and I want to get to those first, and I feel like it's appropriate to get to those first. We're going to get through that treatment plan first, but it might take, with the way dental insurance is these days, it might take us a couple years to get what's recommended done, and
Mhm.
depending on the patient's finances and this that and their time and this that and the other. So the MyTap is a great solution for patients that have those kinds of treatment plans, where we can then make them a chairside, a provisional device to at least address the airway while we're working up the diagnostics. And then as the dental work is changing, those, as you know, those things are very easy to adapt to new dental work.
Right. Well, so you know what that you just illustrated is, you get a chance to think through using a lot of different approaches each case.
Hmm.
Isn't that an interesting way to practice?
It is. It is. It's I always tell patients, patients they think that they're paying for, a crown, a filling, but they're really paying for the clinician's knowledge.
Right.
And so that's how I try and approach every patient situation. And we just had a patient call in even this week that asked, "What device does your practice make for patients?"
Yeah.
And I love that question because it gives my front office the opportunity to tell the patients that we make the device that is most appropriate for the patient, and we can't decide which one is most appropriate over the phone. Dr. Mark has to evaluate, your mouth and your teeth, and allows me to be a dentist evaluating teeth and gums first and foremost, and then based on that clinical assessment of the health of the teeth, the gums, and existing dentition and restorations, that really provides a better platform as far as how I'm going to select the patient's device.
There you go. So how do you see this expanding in your practice and kind of dental sleep medicine in general over the next few years?
Well, my hope is that more general dentists that are primarily restorative dentists are brave enough to onboard dental sleep into their practice. I think that, we look at a lot of practices out there, and some of them are just, focus in on just sleep, facial pain, TMD, and we'll do anywhere from 30 to 75 appliances a month. And then you have our general dental offices that might do 2 to 10 appliances a month. And I feel like the awareness could have a further reach if the majority of restorative dentists are able to incorporate dental sleep medicine into their practice just by a simple mechanism of screening and opening the conversations. They don't necessarily have to treat their patients, but absolutely start talking about it with their patients.
So you mentioned, for example, that your front desk, when somebody calls and says, well, what appliance should I use? And you'll say, they say, we don't know. Dr. Mark has to see you. But you also have your brothers in your practice. Do they do dental sleep medicine, or is it all filtered through Dr. Mark?
Well, currently it all filters through me as
Yeah.
of now. We hired Nexus Dental Systems to make our processes more mainstream, so that Dr. Michael and Dr. Don can start practicing sleep and seeing their own patients. Because what I found over the years of doing this is that, I get external referrals. A large ENT office refers to me. There's some sleep physicians that refer, and even some medical offices. But the patients, they always are hesitant at first going to a new provider. And so if their general dentist, and this happens even with my brother's patients, like even their patients that see me, they still hesitate to see me because I'm not their dentist.
No.
And for some reason, their patients, dental patients, are very particular about seeing their dentist. So I'm a big believer so I have kids that are very young, and we watch a lot of Disney movies, and my favorite Disney movie is Ratatouille. And
Right.
in that movie, the philosophy is anyone can cook.
Right.
And so I kind of have that philosophy in my mind as far as anyone can practice dental sleep medicine. Any dentist can practice dental sleep medicine. It's just, do you want to do it?
You just need to send your sleep champion around so they can pull on the hair just right, and get
Right,
get
exactly. Yeah, yeah. Get those airway metrics keys just right for these patients and show them.
So really, your practice is kind of like any dental practice, even a standalone dental practice, a single dentist, because like your brothers, they can screen, but if like your brothers, they don't want to treat it, they can find somebody in their community. In your
Right.
practice, it's around the corner down the hall, but in another office, it might be down the street, right?
Exactly. Yeah. Yeah.
So, do you weave your dental sleep practice within your general practice, or do you have like separate days or separate segments of time, or how does that work?
No, I keep it like, I might prep a crown and then step away and do a sleep consult.
Okay.
So it's just we just say wherever there's an opening, schedule the patient. We don't like to do specific days, because in this day and age, uh, patients, they can't accommodate their schedule as well as we would like them to, and so we just say whatever's convenient.
Well, because in these days and age, they have to actually get dressed and go someplace,
That's
So
right. Yeah, they do. Yeah.
we're all used to not having to do that so much anymore.
Yeah,
Except
so I
us.
like so I will prep a couple fillings, do the fillings, prep a crown, go do a sleep consult, maybe take an impression, deliver a device, titrate a device. It's all I feel like that dental sleep medicine, because of the materials that you need to practice, it's not so much different than taking impressions for a denture, for a full arch for crowns, stuff like that. It's you have the materials. Dentists have the materials in their office.
So you're impressing, not scanning, right?
Yeah, we do not have a scanner. Well, we do have a scanner, but I take PVS impressions much faster than I scan.
Oh, okay. Wow.
Yep. So the scanner that we did have is a no disrespect to Carestream, but the Carestream 3600 did not blend well with our system.
Okay. Well, that's just one of the so other technology that you feel like a newbie would have to think about. So they don't need a scanner. You obviously can take impressions. Scanning works fine, by the way, in many offices. So so scanners are fine, impressions are fine, just as long as they're good quality of both kinds, right?
Oh, yeah.
So what else does a newbie dentist need to get started with dental sleep medicine?
They need the appropriate forms for documentation. So we were using Dental Sleep Solutions software. When we switched over to Nexus Dental Systems, we prefer their forms much better. It actually blends better with our workflow. Fillable PDFs is what we're using. And so we just have the copies on our server, and we're able to access them and save them and edit them as needed. So I would say definitely we need some forms, some paperwork. Documentation is absolutely key. Having good chart notes, which you can do off of the Nexus Dental System. And then other than that, just having the the guts to do one.
So hard equipment, we established you don't need a scanner. What about, do you take vital signs? Do you take X-rays? What do you do for your?
Yeah. So let me walk you, Steve. Let me walk you through our first consult, like our initial consult. Our assistants will go ahead and take their blood pressure. So just having like a wrist blood pressure cuff. They're pretty cheap on Amazon. That's where we had found ours. 4 bite wings. I just start out with 4 bite wings just so I can see the condition of the teeth that I'm working with. What I found is trying to obtain bite wings from other dental offices is very hard and just delays the patient, and it just opens up cans of worms that you don't even expect. So we don't charge patients for those bite wings. It's just my preference. I don't want to interfere with insurance frequencies on bite wings, so that way it's they can go back to their general dentist and nothing is disrupted. They don't have to contact my office for additional x-rays. I will give them to dental offices as needed. So they'll get 4 bite wings. If everything looks good on the bite wings, I will do a limited dental exam, check the condition of the teeth. Majority of the time, things look great. I will ask the patient if they have any pending restorative work. Most of the time, they're pretty good. If they do have pending restorative work, then I take that into combination for the device design. I go through the airway exam through Nexus Dental Systems, fill out the forms, do the TMJ analysis, and then we will then set them up for their next appointment for their impressions. In the meantime, we've pretty much already obtained the majority of the documentation that we need for insurance, for prior authorizations, if it's required. We'll have their sleep study, their medical insurance card. We'll typically have a prescription for a dental appliance. So everything that we need we'll have before the impressions appointment.
Okay.
I typically will not take impressions on a patient if we do not have a prescription from their medical provider.
Okay, good. So you didn't mention it like a panel or a CBCT. So you don't. That's not a requirement in your office anyway.
No, not in my office. Some offices I understand they take them and they're able to get reimbursement from medical. I just don't find the panos, as far as looking at the TMJ, very diagnostic at all. Okay. So I just leave them out, and that's how we work.
Yeah. Do you guys have just aside? Do you have a CBCT in your office?
We don't. Yeah, we don't yet. Yeah, so we're working with multiple dentists. I guess the order of importance on certain things, purchases, we have to all agree before something is purchased and split the cost on all those things. So it's
Sure.
yeah, that's just one of those things that just isn't quite where like the older brother and the younger brother just aren't quite ready for or see a need for in their practice yet.
That's just a whole other conversation here.
That is.
So, your insertion into your group practice was a family thing. Think about it from a term of an associate coming in, or maybe even a part of a DSM walking in. What of your experience could they take and make themselves brave enough to insert DSM into their practices when they don't have brothers to talk to? Or did that make it harder? What do you think?
I think having family involved makes anything a little bit more challenging. Just because there is the emotional component of being in practice with your brothers, and then just you kind of want to be, I don't know, it's almost like family first and then dentistry second.
Yeah.
But it's, I don't know, it's hard. My older brother is the original. He bought the practice from my uncle, and then me and my younger brother, I'm still an associate. My younger brother is bought in just recently, so he's a partner, and so I'm still working on partnership myself. But yeah, I mean, it's just I don't know how to answer that question, to be honest with you. It's I feel like that it's you could be in potentially a bad situation as far as an office wise and not even realize it because you're so emotionally connected to not only your patients but also to your office team, and then your brothers happen to be your co-dentists.
Yeah.
So it's difficult.
But having a new service that gets people excited and you can do something medically for them, that never hurts a young dentist or an associate dentist as a skill set to walk in with.
No, I think it if anything, it allowed me to become very good at taking full arch impressions, which translated into very good Invisalign impressions, very good study model impressions, crown and bridges, doing higher end dentistry and having good impressions for multiple crowns, large bridge cases or large restorative cases. Being able to look at teeth differently as far as this tooth needs a crown, but why does it need a crown? Is it just a crack? But why is this patient cracking teeth? Why is this patient having TMJ issues? As a consequence of being a DSM provider here, I seem to understand the TMJ a little bit better than my younger brother and older brother. So then I tend to see some of their patients that are having some facial pain and treating them a little bit differently.
More things you have to think through versus having to do through, right?
Absolutely.
Yeah, and that's an interesting challenge for dentists of any age, is to be able to translate what we know into how we can help our patients versus what we can do with our fingers and how we can help our patients.
Yeah, it's always funny how I look at patients and I see these class 5 composites over notched areas, and I just think this person, they probably have sleep apnea of some sort or some sort of clencher, and they might not necessarily. The dentist, I think, the restorative dentists think we got to protect this, but in my mind, I'm thinking we should probably make a night guard of some sort that's going to decrease the clenching forces, and then make the restoration second. Whereas, so my brothers might think, let's do the restoration first, and then maybe down the road look into making a night guard.
So it's an expanded way to think about your patients.
Absolutely.
Yeah. Well, one of the questions that's come through is you haven't mentioned anything about children yet. And many dentists are hearing that we can have a big impact on children's airway. So do you guys do anything with that in your practice?
Yes, we do. So my younger brother, Michael, as I was starting with the dental sleep medicine part, he also was looking into expanding his practice as well because there just wasn't enough restorative dentistry for all three of us at the time. And it just so happened, coincidentally, my sister, her third child was having breastfeeding issues. And there's a whole social media group regarding that particular topic. And one of the girls on that group knew me from, middle school and asked my sister if one of her brothers could start doing frenectomies in our office because at the time, no one in Indianapolis was doing them. These patients were going to Dayton, Ohio, which was the closest, provider was in Dayton, Ohio. And so we hired that dentist in Dayton, Ohio to come over to our office and train us. And at the time, that was when my first child was born. And hearing the babies, was very triggering for me. So my younger brother took on to it very well, and his practice with doing infant frenectomies and even toddler frenectomies as it pertains to speech language and breastfeeding has exploded for him. And I think it's at the point now where I've been trying to push him into diving a little bit deeper into airway because he already has a great patient base for that.
Right. Right. So there's another niche. We'll have to maybe we'll have your brother on and talk about that at some point. But
absolutely.
But the kids are, I think, the place that dentists can have the most impact on community health because
absolutely
they're going to grow up to be adults. So well, Mark, this has been a wonderful conversation. I think you have sent the message that anybody that's interested in getting started in dental sleep medicine, they just go take a course. Take a course from any of the providers you heard about today, and then be brave enough to come back to your practice and do something about it. And insert yourself into the family situation, which like you said, was complicated, but hey, you made it work and it's working for you. So if it works for you and worked for Aaron Elliott and works for me, then it can work for anybody who's watching this. And so
absolutely. Yeah.
Support systems like Nexus and the network of folks you get plugged into when you join membership organizations, all of those things can help out. And reading dental sleep practice, of course, you gotta think about that. Will allow dentists to have a big impact. You're making big waves in Indianapolis. Just mention that last bit. You're the first practice in Indianapolis to offer frenectomies for little kids. Imagine the marketing potentials for growing your practice that way.
Mm-hmm.
So, closing words. What would you like to say to our audience that's enjoyed this conversation so far?
Well, thank you for tuning in to this conversation. That means that you truly care about, furthering your knowledge and your practice of dentistry and dental sleep medicine. And, just if I can be of any, help as far as answering questions or mentorship, like, Doctors Drake and Yatros were for me, I am more than happy to. We can pass along my email if anyone needs any help getting connected with Nexus Dental Systems. They have great solutions for onboarding sleep testing into offices, onboarding training the assistants, the total team training. We've had a great experience with that. And it's starting to really flourish for our practice and for our other dental providers. And I don't know what else to say. I'm very fortunate and gracious to have come across such profound providers early in my career, and to have some pretty neat and successful outcomes from my early and current patient base.
Fantastic. Well, thank you everybody for your questions, but we've run out of time for today. If we didn't get to your questions, you'll answer it after the webinar via email. Shortly, we'll send you a link for a replay of this presentation. Thank you all again for attending, and a special thank you to Dr. Mark Newman. Best wishes and best luck to you in your growing practice. It sounds like you're tremendously successful, and that's only going to get better. And our sponsor for this webinar, Nexus Dental Systems. Thank you, and be well.
Thank you.